Good morning and welcome. Thank you for joining us for today's special virtual family forum, Beacons of Hope, Inspiring Families Amidst COVID-19. My name is Tiffany Fearon and I am the Client Services Manager at Family Councils Ontario. For the past few weeks, we have been hosting virtual forums to provide a safe space for families with loved ones in long-term care to share their experiences, receive ideas, and support. It is such a pleasure to host this session to discuss the amazing work done by one particular Family Council member. We do have a bunch of highlights that we are going to be covering for this session. We're going to be having the opportunity to get to know our special guest, Julien Morelli, where he will share more on his personal background, his involvement on with his family council, being featured in public news outlets, and how he's navigating the pandemic with a loved one in long-term care. We will then learn about the amazing PPE donation Julien secured and how that came about. Afterwards, we'll open the floor for an open discussion and close with key takeaways that we can all learn from. Before we jump in, I would like to quickly go through our forum directives for all participants. All attendees will be muted. We also ask that everyone joining us mute their microphones on their end so that we can avoid hearing any background noise. Just a reminder that this is a safe space for peer support. Please allow anyone speaking to finish their thoughts before responding. Be kind and respectful, and be sure to share ideas and solutions. My team members are also on the line, so if you are having any issues hearing, please send a message in the chat box and you will be messaged privately. Also, if you look to the right of the screen, you do have a control panel. Throughout the session, you will be utilizing both the mute your line button that's highlighted in green and the raise your hand function. On this call, we do have Julien, who is a family member at Villa Marconi Long-Term Care Home in Ottawa. We also have myself, Tiffany Fearon, the Client Service Manager at Family Councils Ontario. We may also have a quick word from Chris Pereira from Huawei, Canada. So the reason for this session was to really switch gears and talk about some of the positives that we've seen throughout COVID-19. We know it's been such a trying time for many families, residents, and staff in long-term care. We've had to change our routines, our way of thinking, and we've lived in quarantine for the past few weeks. We wanted to recognize how essential families are in the sector and how impactful they can be when they practice the following. Families can be beacons of hope when they look at giving ongoing peer support, lending a hand, being compassionate, exuding leadership, connecting through joint experience, being resilient, and of course, growing through hardship. I think it's time that we do hear from our special guest, because I'm sure all of you would love to hear the great story that he has to share. On your screen, we have a picture of Julien, his wife Heather, and his mother-in-law Mary Lou, who resides at Villa Marconi. Julien, I'm going to prep you to get ready to speak. And if anyone, again, has any issues with audio, please put a message in the chat box and my team members will respond to you. All right, Julien, are you there?
Yeah, I'm here. Can you hear me?
Yes, I can.
Okay, good.
Thank you so much for joining us. I will let everyone know that I have had such an exceptional time connecting with Julien and receiving his updates as well as his views on what's going on. He has really shown himself to be a dedicated family member and always remembers to share some of the positives with me that he's learning throughout this experience. So Julien, how long has Mary Lou been at the long-term care home, Villa Marconi?
Roughly about a year and a half. It's about 18 months, close to that. Yeah. It started in December, I believe, 2018.
And how has your family adjusted to having a loved one in long-term care?
Well, I mean, it's a learning experience right from the start. It's a bit overwhelming at the beginning, and you're walking into a completely new environment. But and so was my mother-in-law, Heather's mom, and you're trying to navigate it, and lots of things to do at the beginning. You have to sign papers and get to know how it works. So it's like walking into a new home, except um, you have to a bunch of rules and things you need to know and how things work, and so it can be a bit overwhelming. I think for anyone I've talked to, they seem to have the um, same issue.
It's completely understandable. It seems as if it's quite a change to go from living in your home to congregate living, where there's many. It's almost like having a lot of roommates that you weren't expecting to have. When we talk about the importance of family councils, we know that it's sometimes a time constraint that doesn't allow families to get as involved as they would be and would like to. What compelled you to become a member of the Family Council at Villa Marconi?
Well, there were a lot of things. I mean, first of all, you're looking at what the situation was, and there was this family council. I didn't know anything about long-term care per se. I knew some because of the work I did in the past, but I didn't really understand the legislation as well as maybe I do now. But at that time, it was like, wow, this is an organization that has, I'll call it standing in legislation, but also that there were a number of issues that we experienced, and we thought we could get support from other family council members, and we did, and thought it was a good way to share experiences and get to know people, because it was in effect, well, it is Mary Lou's home, and in a way it became our home too, and you get very close to people as that happens, as you work through it, right? And so it's sort of I guess the way in which to get to learn things, and we really felt it was important, and it was.
In our discussions, we've really talked about the mobility of families and what they can do when they do put their minds to achieving something. When we talk about the Family Council powers under legislation, it's something that many don't know about or don't have knowledge about. In terms of your knowledge of the powers, how has that influenced the way that you're an active participant?
Well, that's a really important one. That's probably the most important. And people get a little afraid of when they hear the word legislation or statute or the act or something. But really, to keep it what it should be, it's very simple in the sense that it actually family councils have power. And I don't like the word power so much as saying you got lots of power, but whoever wrote the family council piece in the Long-Term Care Act knew something, and they added words like the administration or the home shall help, shall assist, and the words shall are a lot bigger than, or even more important than the word must. And it's not a long read. It really tells you where you can go, what you can do if you're not getting satisfactory information or services, or you're concerned about something. And the more I looked at it, I was shocked actually how much authority or power a family council actually does have in law. And I think it means something to say it's in law. And so what I did is I started to read it, and my background in say the political world and other things led me to say, wow. And so I engaged the Ministry of Long-Term Care, and as I learned, I followed what what a family caregiver or a resident can do, and they can do lots. And the biggest thing I learned is phone calls are fine. Always try to work with your home administrator first and your home people, nurses, everyone, doctors. But if you're not getting a satisfactory result, then pick up the phone. There's a phone number, an 800 number, and I think the Family Council of Ontario always promotes that. Or send an email because you want it documented. If you just complain within, or you just try to always keep it within the home, it really, the documentation stays there. But if you report it and you have a legitimate concern, and even if you don't know if it's legitimate, just a concern, use it because it gets documented. And if the biggest thing I learned is don't be afraid if you don't know the words, because you can call anybody. You can call the Family Council of Ontario, like yourself, Tiffany, or Samantha, or I'm trying to remember all the names, but I mean, it's there. And it's I was surprised at the authority, and if you're not getting it, I can't say it enough. Use it, and don't be afraid to ask what you might think is a dumb question, because they're not.
I totally agree with that sentiment. And I think that's one of our main missions, is to cultivate effective family councils. And that's what is done when family councils are informed and aware. And I understand the word power sometimes comes across a bit assertive, but sometimes that's what families need to do when they are advocating for their loved ones and their residency in long-term care. And it's important, as you said, that they're informed and they're aware of what they can do under legislation. We do know that everyone's experience is really unique, and it's hard to put everyone in a box as we navigate COVID-19. And we know from what we've heard from other families in emails, phone calls, what's going on at each home is very different. So it's hard to say that all long-term care homes are doing the same things. What's been the experience for you, Heather, and your mom during COVID-19?
Well, like you said, I think it's important to say that everybody's experience is unique, and everybody has a story. Everybody has a background. I don't care what you've done in your life, whether you're a millionaire or you're a ditch digger. In my view, all the same. The only difference that I see, the uniqueness comes in the fact that you can learn from your own experiences and others. But the commonality is, we know, and I mean, just to be frank, long-term care was at the bottom of the totem pole politically, and it was unconscionable. It never should have been. We knew that long-term care was most vulnerable. At least some did, and those who didn't should have. Our leaders have something to account for later, and that's not the time now. But in our case, the hardest thing for me is watching my wife, Heather. It's hard because I can't imagine if my father or mother was still alive, how I would be. I'm the mother. I'm the son-in-law. I consider Mary Lou my second mom, and she gives me a lot of guff sometimes, and she's right, and she's but but she's special. I'll just I'll just say that she's special. And so what's happened now is I watch my wife get up in the morning uh, and pace. And uh, and I know that applies to everybody. So we're not unique, and it isn't about me or it isn't about us. We all have stories, but the commonality is we all know that long-term care needs to be fixed. And I know it sounds like it's political, but I'm not being political. I don't care if you're red, green, pink, blue, conservative, liberal, NDP, whatever. This thing here, if we don't fix it, it'll come back. And I don't want to see my family or anybody else's family, if I can help, ever go through this again at this level. Never.
I think it's really important that you said that despite the unique experience, there is something to say about the joint collectiveness of families right now that are enduring the constraints of COVID-19. And we know that you've been quite an advocate for many years, and you've been featured on different news outlets and interviews, in articles that individuals can read and hear about what you've had to say about long-term care. How important is it for you to do that and to continue to be vocal publicly?
Well, it's two things. That my background is like in communications, and a director of communications in the political world, and for NGOs. I mean, it may sound easier because I understand it a bit more, but I'm just as afraid to go on national media or local media and speak. I get the fear. My worst time in the morning is the morning when I first wake up. I have this kind of gloomy feeling. My cat wakes me up. My cat brings me back because he needs to eat. And but we all have fear. So I have fear of going on the media, but I can't live in that because fear right now won't resolve it. And I understand everyone else's for not speaking up, and we're having a hard time speaking up. But in my case, I utilized the tools I had, and I reached out to media because I knew this was going to be an issue, and I knew that it needed to become something of front and center, and a lot of people that you're hearing about now, they've really raised the issue to the level it should be. So that my experiences have been good, and some a little not so good, but I expected it. Some people didn't want me to talk. Don't talk. And I thought, okay. And some people said, say more, get really aggressive. Okay. And I thought, okay, if I don't talk, what's the impact? And if I do, I get so aggressive that it sounds political or it sounds too harsh. What's the impact there? What good will it do? Somewhere down the middle, I tried to keep it that way, but I needed to be real. And my wife did some fabulous interviews, and she's never really done them before. And why they were so effective was because she was real. Didn't use big words, just talked from her heart. But I did get some negative. Well, Julien, you shouldn't be out there. And I thought, well, if I don't speak up, what's going to happen? Or if somebody else doesn't speak, are we just going to bury this under the rug? Because it can't be buried, and nor should it be. And then I thought, if I can't speak up for my family, then who can I speak up for? Everyone's different, though. It doesn't mean you have to jump into the media. There's lots of ways. Pick up the phone and phone somebody and say, how you doing? Or here, I'll make a few masks, or I'll get involved in trying this because I heard of somebody who's doing this. So my experiences have been, I guess I'll finish that off by just saying this. Out of the 1 or 2 or 10 or whatever it is that were negative to me, we've had hundreds of positives, hundreds. I've met people I never knew before, beautiful people.
And I think that's what makes it all the worthwhile, that it's in our experience and our passings with people that we learn so much more. And sometimes a person can be the puzzle piece or the connection that we need for something big to happen, which is a really great segue into what we're going to get into next. So for anyone that read our most recent blog, we did feature a quick summary of Julien's involvement in securing a really large donation of PPE equipment. On our screen now, we do have a picture of Julien and Chris Pereira, who's the Senior Director of Public Affairs with Huawei Canada. So that's an awesome selfie. I would be proud to also snap a selfie while doing that work. So Julien, if you could give us some insight about how this came to be. From speaking to you, I've heard this was a chance meeting. It wasn't anything planned. So we'd love to hear more about how everything was coordinated.
Well, I really want to say how real it was and how chance it was and how it went. I do know one thing. Chris is trying to get on and is having a bit of a problem, so he might join us once he gets it figured out. But it started back in early March. I was to have I'll call it a business meeting or a meeting. I never knew Chris. We were supposed to meet on March 7th, and both of us had the wrong date written down, and we both tried to say it was I tried to say it was my fault. He tried to say it was his fault. So anyway, a week later we met, and that was just when they were getting serious about the quarantine, and there was nobody in Ottawa. If you're familiar with Ottawa, there's a marketplace area, the market, and there was no one in this restaurant. There were no cars on the street. I could pick any parking spot, which I've never seen before. So we met and we sat down and we got talking about certain things that unrelated to long-term care, and somehow the conversation went into long-term care, and I started to speak about what I thought was going to be a real issue, that long-term care was going to be the most vulnerable and that people were going to be in really bad shape because of the vulnerability. They were the most susceptible to infections, and their immune systems were compromised. And so we just talked and left it at that. And we, promised to meet again. We had a great conversation. We were going to get together once this was over. About a week or so later, or so, and I think Chris called me, and he just happened to say, "Julien, do they need help? Do they need equipment?" And I said, "Absolutely." And then we talked about it and went through the whole thing, and we went, gauged what he could get, what was needed, all of that sort of stuff. And we eventually arrived at 100,000 masks, and 21,000 of them, we decided, and I spoke about the need to allocate those specifically for long-term care homes, and the rest could go to a central repository, if that makes sense. So 21,000 got allocated to long-term care in Ottawa. And so what happened was, we didn't get any media. I put a post up on Facebook, and then I put it up on LinkedIn, and it went crazy. And I think it was because it was so real. We were wearing our masks and we were doing our stuff, and it, like, just on LinkedIn, for example, 125,000 views. I've never heard of that. There was no ad work, no nothing. It was just, here's a post, we got some masks. And Chris, I can't speak enough for. I really can't, because a lot of the focus has been on me, and he's wanting to stay, as much as he can in the background. But I felt it was important that people know that this was a real grassroots thing, about as grassroots as you can get. And it's, the Huawei Corporation helped. And I know the political story behind it all. I was asked by the media that. And I'll just say this, and I think it's important. When they did the Toronto Star asked me if they could do a column and if I would comment. And the first question that came was, did you hesitate on who was giving you the masks because of the political stuff? And I said, no. In fact, if I could have done anything, I would have got more. And I said, there's enough politics out there right now. I don't care about the politics, and I don't care about whether they come from China, they come from Africa. I don't care. What I do know is I care about the people in long-term care homes, and I care about my mother-in-law. And if somebody doesn't want them, then don't take them. And I make that point because we hear politics every day on TV. We're hearing it every press conference. And the leaders are trying. I'll give you that. And they are. They're trying to fix this thing, but they don't have a choice. They have to fix. They have to fix things, and they have to lead. In our case, this was so grassroots. Even one of the ministry officials' spouses got involved to help us deliver the mask. That's how grassroots it was. So I don't know if I answered your question, but I tried to keep it short on how it came about. It was a chance meeting. And just the good news about it, we got 100,000 surgical masks, which are the blue ones you see it in most places. And just this morning, we just delivered, and the ministry picked them up again, 10,000 high-grade masks that are like an N95 or an NP95 mask that are way more filtration efficient. So we just delivered those 10, and these masks specifically are just for long-term care because they're the ones in need. So that just happened. I think you have a picture up right now that shows some of the masks.
I think it's just amazing. For anyone that doesn't know, Julien is an early bird. So he literally starts at the crack of dawn, really working on these advocacy projects. He actually picked up and did some work this morning with these masks, actually, and is here in time to be on the session. So we know for sure that he does not stop working. I'm just glancing over to the chat box and seeing a lot of participants making comments about wanting to do some efforts and talk about different issues in long-term care related to staffing, shedding some light on different issues and things like that, but not getting any headway, which is understandable. It's definitely a sector that, as you said, needs to be improved, which is why we really wanted to hear from you and hear this positive story and how you were able to enact change. And we see the power of conversation, that you were able to communicate to Chris a need and he was able to fulfill that. So that is amazing. How do you feel about being involved in this?
I guess, can you just ask, the question is involved in this whole thing?
Yes, involved with this great donation.
Well, actually humbled, and I mean, I have some certain beliefs in life and certain beliefs about, whether it's religious or otherwise, but I also don't believe in coincidences. And I remember saying to Chris something about, just when we started, this is our first meeting before we even talked about masks. I said, this meeting's happened for a reason, because when he walked in the restaurant that first time, he was talking. He didn't know me. I didn't know him. He went and sat down saying he had a meeting. And about a minute later, it clicked in that this must be the guy. So I went over and said, "Are you Chris?" And he said, "Are you Julien?" And then we started laughing. And that kind of broke the ice from a business meeting. And I said, there's something about this meeting. I think I said something to the effect, I don't believe in coincidences. There's a reason for this. So I feel humbled, and I actually feel like really humbled about the fact that some media have called me, and I've turned down a lot of media because I didn't want to talk politically. And I turned down more media than I took. And so it wasn't about me. It was about saying, I don't care. People think that big corporations are all evil. I don't buy that. That millionaires don't care. I know that's not true. That executives are just out for themselves. I know that's not true. But I also know that there are some that are that way. And so I just feel privileged, I guess.
It's really great to hear that you opened up, not only about your personal experiences, but about the ways that we can be compassionate to people we don't know, and not act with judgment before we get to know them. I think that's great sentiment and a great takeaway, that we have to know that our connections can be really big, and the people that we come into contact with can become lifelong friends, or individuals that are going to help us in our initiatives with their own connections and even possible power in their own role. So I think we have to look at the greatness of chance meetings and be open to them too. Now I think it would be really great to hear about some of the other participants on this call that might have questions and comments, or even some positive things they'd like to share about what they've been able to do, big or small, in their long-term care community. So we are going to open up the floor. We do have a bit of an instruction on the screen right now, just to ensure everyone can participate. So if you would like to speak up, you can use the small hand icon. It's located in the control panel. So we have a picture of it to the right there on the bottom. And once you put your hand up, I'll be able to unmute you on my end, and then you will have to unmute your device as well. You can also type questions or comments into the chat box, and we can read them aloud. So I don't see that we have any hands up right now, so I will move. Oh, actually, we do have one. It's from Heather. So Heather, I'm going to unmute you right now, and please feel free to speak up.
Oh, okay. Well, first I want to thank Julien for everything he's done. Because he really tirelessly works on this every day, all day. So I'm just putting that out there. But, you said something about, what can families do? And I think one of the difficult things is that because we were, locked out, so to speak, without notice, a lot of families don't have the connections with other family members. We reached out to family members at our home because, we see them every day and we know their names and everything. So that is a difficulty with a lot of families, I'm certain now, because they don't have the connection with their families. And I have to say that it has helped us a lot to, hash things out with other family members that are going through the same thing in the same place. It kind of gives you a bit of comfort. And we don't know how long this is going on, but it would be nice to somehow, maybe Family Council Ontario can figure out a way that we can open up dialogue with other family members. I'm not sure if I'm being clear. Like have we have their phone numbers and that sort of thing, but I mean, a lot of people that you meet in a home, you don't necessarily know their last name and that sort of thing, right?
Yes, I totally agree, Heather. And I think that's why our organization, we've really wanted to stress the importance of families meeting for that peer support, whether it's families from the same home or from neighboring homes. So we do have a database on our website that does include for family councils that do sign up, and they can include their contact information as well as the main person that someone can speak to, and a little bit about their home's family council. But the thing is, we want to encourage more family councils to do that because it's completely voluntary. And if people are able to volunteer the information to the database, it would be a real connecting tie. So I'm really happy you brought that up. It really is for families to want to unite and communicate, and once they enter their long-term care community, to really be open to meeting new people and making those connections. So I think that's a great point to come up.
Yeah.
So thank you, Heather. It looks like we do have another hand up. I see Liliana, are you able to unmute yourself?
I just, again, wanted to say thank you to Julien for all of his efforts with this. I agree with Heather. He has been working tirelessly to make some significant positive changes in this situation. So I just wanted to say thank you to Julien for all of his efforts.
That's amazing. Thank you so much, Liliana. And I think Julien he's been very modest, but I know from talking to him and getting to know him the past few months, actually, not only has he been really supportive to me in my role as in client services, but he is very modest about all that he does do. And this is a big deal, securing such equipment that we know right now is in high demand, and doing that from morning till night. We are very pleased by his efforts, and it definitely shows us that when we're determined to do something, it can be done. So thank you so much, Liliana, for sharing that.
Well, if I can just, it's about trying to do something. Like, I can't go back any further than to say it's about everybody's family, and unfortunately so far Chris is still having a hard time coming on from Huawei, but he's a real piece to this. He really is. I mean, this guy, I've worked with a lot of people, and everybody's worked with a lot of people, but I have to say, besides you, Tiffany, he's awesome. Honestly,
thank you.
We talk and we joke a little bit, and you have to joke. I watch, we all have to take a break and not get so serious. Like, I watch the Beverly Hillbillies or something at night. I binge watch it. I make masks now. I'm all proud of those red masks I made. So you learn a lot of things. And one of the things I've learned through all of this on the optimism side is how good people really are. That really is true. You're going to always have, I'll call them the people that aren't so nice, but they're a small minority, and that's why a collective voice, and I don't want to sound like we're out there protesting, but maybe at some time you might have to, but you'll outweigh those negative voices. And there's so many special interests out there right now. I'll talk about that a little bit later, but just even standing up will make a huge difference politically, from a business perspective. That's when they will listen. So I want to go back and just thank Chris so much. And he's kind of the unseen person, and and there's reasons he doesn't want to speak too much, but I've kind of really trying to give him lots of hugs as much as I can.
And I think it's great for people to see the visual of Chris being there. It's not so much as just coordinating it and sending someone to handle how it's done. He was there with you, with the gloves, with the mask on, to really deliver this large parcel and be there for that. So I think it's really meaningful. We do have a hand up from Joe. Joe, I'm going to unmute you. If you'd like to unmute yourself, you can offer your comment or question.
Thank you very much. And I want to start off by saying a special thank you to Julien. I've known Julien for almost a year now, and I can tell you he has worked tirelessly regarding this whole thing. The amount of work that Julien has done is just absolutely incredible. My mother was in a long-term care home for about 2 3/4 years. Prior to that, I lost the other 3 members of our family. I lost my father-in-law, my mother-in-law, I lost my father, and then lastly, last August, I lost my mother. What I learned in all of this, and this all transpired, it all began roughly in 1998. So been dealing with all of this for many, many years. What I learned was basically that all the long-term care homes that I saw and that I was in all of those years, they were all swimming naked for a very, very long time. What I also learned was absolutely nothing was done about it. Nothing was done about it by the administrators and by government. Now, the one silver lining behind what has happened with COVID is that the coronavirus has exposed all of these inadequacies. The employees don't really know the residents' requirements. The employees are always changing, and they're always working at several homes. There's no consistency, and all of these poor employees who are trying to help everyone are receiving a very low pay. There's an inadequate number of employees at all of these long-term care homes, and I think the COVID has exposed all of that. The residents are not changed properly, they're not fed properly, and they're not hydrated properly. All of these deficiencies lead to one UTI from another. And what happens is all of these residents become debilitated and get worse and worse and worse. And a very high proportion of all of these residents, due to the UTIs, end up in the hospital, end up with pneumonia, and end up dying. I noticed that the government was very slow to move in and help, even after UTIs, or not UTIs, but even after COVID-19 hit. So one of the questions that I have for Julien is, do you think that the governments will now do the right thing? So that's number one.
Okay.
My other question is, why are long-term care homes so unprepared? That's number two. I've also noticed that some long-term care homes have what I call rogue administrators, railroading caregivers. And why are governments allowing that to happen? Why is the public allowing that to happen? I don't think that the caregivers speak up enough. I think that the caregivers should speak up about the lousy food that the residents are being given. They should speak up about the changing of the residents. They should speak up about the hydration problems and the fact that the UTIs are killing all of the residents. UTIs lead to debilitation, and they lead to pneumonia, and they lead to death. So here is the advice I have for all caregivers out there. Please speak up to the administrators. Please speak up to the director of care. If you don't get proper answers and things getting fixed, the next course of action is to speak to the Ministry of Health. File complaints with the Ministry of Health. Launch investigations with the Ministry of Health. Don't be shy and don't stop.
Thanks.
So that's basically what I have to say.
Thank you, Joe. I really appreciate that. I'll let Julien respond to the questions.
So my first question, Julien, was, do you think that the governments will do the right thing now?
Well, actually, I'm going to try to be, well, I'm going to just say what I think, but I also want to say a couple things with that. Yes, they will now. That's what I'm afraid of. It's after. Governments, politics is relatively easy, and it's made complicated. First of all, I think the day, and I hope the day of the speaking point politicians is over. I hope you have, when someone can talk like you and use the same language as most people use at home, we don't say we're moving forward when we go home. We talk about, I want the dishwasher fixed now. Oh, okay, I got to fix it. You know, that sort of thing. First of all governments in North America and throughout basically failed, and they're starting to admit it because they don't have a choice. They're talking about hard decisions. The hard decisions were back in January when fundamentally it was known. 30 million people in China, Wuhan, got quarantined. I don't know how much more evidence you need than that. I don't know how much more you need to know that the virus was going to get on a plane at some point and come on over. There was economic, I suspect there were economic decisions. But to your question of will they act? They will act because politics are easy to figure out. And I just hope it doesn't become I'm a conservative or I'm a liberal or I'm an NDP. And people say, I don't care who you are, fix it. And if there's enough people doing it, governments, all of them, everyone I've worked with, it's all about the next election. I hate to say that, but it's true. So I've heard, Julien, you don't understand the big picture. I said, really? And I listen, because you want to listen to what somebody has to say, because you learn. And I said, what I responded back with was, I think it's you who doesn't. In fact, I know it's you, because what you're looking at is the poll numbers in the next election. The big picture is that we have seniors and we have cultures that respect their seniors, like the indigenous culture. They actually revere their seniors, their elders. I love that word, elders. The reality is there was ageism. That's my view. Well, you lived long enough. As far as I was concerned, when my father was sick and he was 94, the first thing I said to the doctors and the physicians was, he hasn't lived long enough in my view. I hope he lives to be 116. So to put a moral value or to put an economic value on an age is nothing short of ageism. So we need to say that and say it respectfully and keep it out of, I always vote conservative, or I always vote NDP, or I always vote Green, I always vote Liberal. Well, I haven't. I've voted in my lifetime for different parties because for someone to tell me that while you're the party, or the Liberal or the Conservatives of 1974 are the same as they are today, or the leader is? No. So I don't know what they're going to do, but I know if people speak up as one and listen to who's really going to do something, not saying we're going to study it. There's not much to study. There's not a lot of policy that has to come. Take a look at the Long-Term Care Act. Take a look at the Canada Health Act. Maybe there's something there they can mix in the Canada Health Act and special interests. There's business interests. There's political interests. There's organizational interests. So those people need to be known, and those groups need to know that for this time, it's not going to happen again because you're going to fix it. And I hope that answers.
I think that's very well put, Julien, especially emphasizing that it doesn't matter about our own singular differences when it comes to our beliefs or our values, but in terms of how we see our older adults or elders, those in long-term care, it's important that we have a real collective and compassionate view of that. So I think your sentiments are really spot on. We do have another hand. I believe, Rena, your hand was up for quite some time. Did you still want to make a comment or ask a question? Linda O'Rourke, are you there?
Hi, yes, I am. Can you hear me?
Yes. Hi, Linda.
Hi. I just wanted to say two things. First of all, just a comment from Heather when she said connecting family councils and having them call families so we can get to know each other. And you're right, we see each other, but we don't have our phone numbers. I think that's an excellent idea. I've been trying to do that, but it's been very difficult. Also, to Julien, thank you. I'm really enjoying your talk and the great work that you've done. And I've met Julien recently also virtually, and he's a wealth of knowledge and he's helped me with some advice. I was going to just ask Julien, have you had any kind of confrontation, or not even necessarily confrontation, but a bottleneck between the family councils of the home that you're at and administration? We seem to be having that problem there. The person that is on family council seems to be not wanting to rile things up with administration. So we're really not getting to where I think we should be.
Well, every council, I think, again, it's all independent. And yeah, there are issues at times. I think what resolves it is that whether you're the family council member or you're the president of the family council, as a member, you can speak up as well and utilize all of those things. We've had issues, and it's, a lot of it's relatively normal, and we've had issues with previous administration. I will say that there was a concerted effort by some to have new administration. It did happen, but it largely happened because of documentation that was sent to the ministry, I would suspect. The only advice I can give you is that pick up that phone. And if you need some numbers of people to talk, if you've got some issues within your own family council, the key thing here is, and I'll speak to it later, but silence. Don't be silent if you can overcome that fear, but your council has to be transparent, absolutely open and transparent. I will say something about the home that my mother-in-law's at. I've had some issues there. There were people on family council that didn't want me speaking in the media. That's true, and I expected that. I'll preface it with this: out of those that were concerned, that said, "Well, maybe you shouldn't be doing this," or you're kind of. I've had 10 times the amount minimum of people saying, "Keep doing it, please." And a lot of times you're alone in this. I get that. But I go back to that phrase, if you can't stand up for your own family and others, who can you stand up for? So that's what drives me. What drives me in the morning is waking up with that little, just kind of a doom and gloom fear. I don't know why, but I do. Like, honestly, my companion here, my buddy, my Boots, my cat, he gets up and he talks about his thing, and that kind of makes me smile. And then my wife gets up and my energy and fear starts to dissipate. But I said to Tiffany, I learned something just the other day, and I can't remember. I think I was on a television program, and I think I taped it, but I can't find it right now. And I'm sticking to this thing right now. It's you can't be angry and smart at the same time. So I allow myself, whatever, 10 minutes or half an hour in the morning to be fearful and angry. And then I purposely try to shut it off. And then I try to work smart. So if there's any phrase I've learned when you're dealing with your family council or with an individual, is that phrase, you can't be angry and smart at the same time. But you can utilize both of those attributes. In some cases, it's an attribute to be angry, to motivate you, if that makes sense.
I think that's a great response, that it really is important for us to gather our thoughts and emotions, but then use them impactfully so that we're, not acting in the heat of the moment and being very smart and strategic and mindful of what we can do. So I think that's a great advice to leave with our participants. I'm shocked at how quickly this hour went by. And I'm apologetic to both Rena and Minnie, who we were unable to have them unmuted to speak, but we know there'll be definitely forums in the future for everyone to participate on and speak up. But I think it was essential that we share Julien's story. Just a few key takeaways from this session are up on your screen right now, and we thought it was very important to leave you with this message that families are really involved in making change for long-term care. You are all very resilient, and you are what makes the life of those in long-term care fulfilling and meaningful. So please mobilize your voices and your efforts. The size of the contribution does not matter, whether it's making your own homemade masks to bring to an organization or to share with workers, or donating material for making of masks. It doesn't matter the size of the contribution. We know that families can inform change and system planning when you speak up and use your voice. And that is why we want you to lean on our organization. We are in constant contact with the ministry, and we share with them what we're hearing. So although we know Rome cannot be built in a day, we think there will be change. As Julien mentioned, things will change. We think it's always great to utilize resources, your talents, your connections, and practice compassion and support. We know there's a lot of frustration for families right now, but also be compassionate and remember that there's a lot of people doing their best with their hands tied. But if we remember to think of them and their efforts, that will go a long way. And finally, I think one of the most important takeaways is that we need to plan for the future of long-term care. It's a necessity. And hopefully it doesn't take another big occurrence such as COVID-19 for things to be implemented. Julien, I'll just ask if you have any key takeaways or any last messages that you'd like to leave with us. I know we wanted to have Chris on the line, but due to technical difficulties, it looks like we won't be able to hear from him.
Well, I'll give him a hug later for all of us. I really will. He is the main key. I just want to go back to that. I want to touch just on a few things if I can. Essential caregivers. Don't listen to the term visitors. you're not a visitor. You're an essential caregiver. People that are in homes, that family caregivers are helping to oversight with medications, whether your family member's eating well, your loved one's having infections. I never knew as a male, I'm a guy, that I would learn so much about the destructiveness of a urinary tract infection. It's a 19th century problem that should be resolved. So you are essential. You need to be in the program, and governments need to listen to family caregivers, and they're not talking about it. And I spoke with the CMA, and I said, if you put an economic number on how many hours and what they do, what family caregivers do in a long-term care home and other homes, you couldn't afford it. They're experts, and I won't back away from that. My wife, Heather, if she hadn't have been involved, she practically gave up her career. My mother-in-law wouldn't be here. That's that blunt. My fear is silence. We get over this crisis, and everybody doesn't want to talk about it because they want to go back to normal. If that happens, governments won't fix it. They just won't. Special interests, big business. If they have to be held accountable, there's a lot of money flying around right now, and they need to be accountable. And special interests would like to see more money flow into long-term care, because money always seems to fix the problem, but it doesn't. If that was the case, everything would be fixed by now. The special interests want to get money, more money, and some of it warranted. I agree with that. Long-term care homes need additional funding. I agree with that. But you also need documentation, rules and regulations, oversight. So don't let them diminish that. Government will. There was also a move to start lessening the rules and the oversight and the powers. So be very cognizant of that. You just don't want people to forget and want to go back home to normal, because it would be nice to just say, hey, it's over, let's just get back. Actually, governments are counting on that. Leaders are counting, some, not all. But that's my fear. The real heroes out there need to be recognized. Like the plumber who came to our house the day of the lockdown starting in the morning in a hazmat suit to fix our sewer backup. And then going on to read later, that's where some of the virus lives. I was terrified. I shut down the furnace. But I asked him, the first question I asked him when he had his hat on and his stuff was, do you have kids? So he's a hero. The grocery store worker who packed my groceries, and I made her laugh with my new mask, but she went out of her way to give me extra bags. The nurses, the PSWs supposedly were at the lowest on the totem pole, but they were the ones taking care of my mom and my mother-in-law. They're the ones that were paid the least amount of money. They're the ones that really would phone us if something was up. This thing, I don't like the term grassroots, and I'm not an activist. If I'm anything, I'm an advocate, I guess, by this now, and I just think silence is the biggest problem in trying to go back to just saying everything's normal again. If we go back to normal was what we had 3 months ago. And Joe asked a good question about why didn't government know? That's a good question. You knew, everyone on here that's in a caregiver, you knew what the issues were in long-term care. I hate to say it, but ageism played in this, unfortunately. And yes, we need new policies, but it's a pretty simple fix. And I think I'm going to leave it with anything, if you're going to demand anything or ask anything without anger, but with being resolute about it, is your elected officials, whoever they are and whatever party they are, if they use the word "we're moving forward" or "we're looking into it," that's not good enough. You've got to say fix it, and fix it now. That's pretty well it, I guess, unless I can't think of anything else.
I think that's a perfect way to wrap up the session. I think you've probably sparked a lot of inspiration in our participants today to really get out there and mobilize their resources, their talents, their voices. And I think we do all hope that we'll see a better future for long-term care. On the screen, we do have some resources and helpful tools that you can utilize. We encourage you to continue to look on the www.ontario.ca website for updates on the status of your home when it comes to COVID-19 cases. Also, tune into your local news stations for stories on long-term care in your area. To connect with other family councils, you can utilize our database on our website and search for other family councils in your city. And of course, visit our website for tools and resources that are developed specifically for COVID-19 for both long-term care homes and staff and for families. So we'd like to close the session. Thank you so much to Julien for joining us and letting us get a better glimpse into your story and your everyday life of being the son-in-law to a loved one in long-term care. And we are so happy to hear all the work you and Heather have done, both as caregivers and as advocates for your mother-in-law. You're a change maker, and we're moved by the dedication that you show to really instill the need for improvement in the sector. We'd also like to recognize Chris Pereira from Huawei Canada. We're so sorry we didn't get to have him on the call, but hopefully in future we'll get to hear from him. So we appreciate the support of all of you in attendance, and we really do hope this gets better. And please hang in there and stay strong, and let's collectively make some change. Stay safe, take care, and have a wonderful weekend. Thanks so much, everyone.
Thank you, and Samantha and Tiffany and everybody. Like, really, your group is sensational, and we should be supporting you more too. All right.
We appreciate that. Thanks so much, Julien. We'll definitely stay in touch. And again, mobilize your voices, everyone. Families are resilient, and you can make change happen. Thanks so much, everyone. Have a great weekend.